Hello everyone, I'm Dr. Ghanee. I am an oral pathologist. I see patients with oral cancer and oral sores and I treat them. Today I want to show you a very interesting case. This patient was referred to me. He was 73 years old and he went to his dentist just for regular checkup and cleaning. He had no symptoms, no problems, no pain, and his dentist noticed this palatal asymmetry. As you can see, on the left side of palate is prominent. It seems that something is growing under the surface mucosa right here. So when I saw this patient, I talked to him about all the possibilities. What is this that's growing under the surface mucosa? All of us were very aware of oral cancer, and we know if we have a red patch or white patch or a sore spot that is persistent and it's not healing, it can be precancer or cancer. But we should be aware if we have a growth under the mucosa and mucosa looks intact and healthy, and there is a growth underneath the mucosa, that could be cancer as well. So what are the possibilities here? One is maybe he's growing a benign tumor there. The other thing is maybe he's growing a cancerous tumor there. Another one is a metastatic tumor. As you know, when we grow cancer cells, they want to travel and they want to go in other areas and nest there. They always destroy the walls of vessels and they enter the bloodstream and they go somewhere else and they nest there. So I explained all the possibilities for this patient and I told him that he needed a biopsy. I want to show you normal histology of oral cavity here. Very briefly, when we look at normal oral mucosa under the microscope, from here to here is called epithelium. That is the surface. And what happens here, in this case, this epithelium is intact in this case. And what's happening is underneath the epithelium. We have salivary glands here that they make saliva. We have fat tissue, fibrous tissue. We have blood vessels, bundles of nerves. These small purple dots, they are lymphocytes. Lymphocytes are immune system cells and they come from lymph nodes and other organs. So in this case, that the surface is intact, maybe a tumor is coming from this area, arising from one of these tissue. So patients listen to me usually, and if I explain the differential diagnosis and possibilities really well, they agree with a biopsy. So this patient agreed with a biopsy. The biopsy was done, and the biopsy was lymphoid proliferation. The result was lymphoid proliferation, which means some lymphocytes that we saw there, they grew and they became more and more. They're making more lymphocytes. This could be a malignant tumor called lymphoma. So I talked to the pathologist in the lab and I submitted and I did more biopsies. I sent more tissue, and the second biopsy showed lymphoma non-Hodgkin's. Lymphoma non-Hodgkin's it was considered a very aggressive malignancy in the past, but now it is treatable. Oncology has made progress and it is treatable. But the question at that point was, is this a lymphoma that is happening on the palate, or is it a lymphoma that is coming from another area? Is it a metastatic lymphoma? So we did more imaging for this patient, and it turned out to be brain lymphoma. Patient had brain lymphoma that extended to his sinuses and then to the left side of the palate. And this was the first presentation of this cancer that was caught by the dentist. So what we learned from this case is when we look for mucosal changes, surface changes like red lesions, white lesions, sores that they don't heal. Also, we should be aware of anything that is growing under the surface mucosa, because that could be cancer as well. And this patient got treatment, and it's 4 years now that he's free of disease. As you know, if cancer is caught early, it's really treatable, and that's why we should always go to our dentist and hygienist, because they're trained to check our oral cavity. Also, we should be aware and check our oral cavity, and as I said, we should check surface mucosa, anything that's on the surface, and anything that's happening under the surface. Thank you for listening. Have a good day.